Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Dr. Ezra Lyon, Associate Medical Director for Integrative Addiction Treatment at Theta Care in Waupaca, Wisconsin. Hi, Dr. Lyon, how are you today?
I'm doing okay. I was on call for our rural hospital last night, so a little bit tired.
Great. Well, thank you so much for taking the time today. So tell me, how does stigma against people perpetuate substance use disorder?
I see this in my practice all the time. I think people who use drugs and people who are in recovery from their substance use disorder really feel othered. And when they interact in the medical setting, which is, my work setting, people often aren't expecting to get help. They're expecting to be turned away. They're expecting to be labeled as having being a drug seeker. They're expecting not to be listened to. And I we've done a lot of work and a lot more work to do in our own medical system to change some of that so that everyone's treated like a person, that whoever comes through the door is just treated like any other person, regardless of what their history is, whether that's substance use or mental health or how they look in other ways. But that legacy and ongoing stigma affects the care people get. And we've had patients who, because they've been welcomed here, will drive 40 miles to get care for an illness, for an abscess, for an infection, because they don't think that they're going to be talked down to or um, I don't know, ignored in other ways. And that just speaks to how much people don't seek care because they are so tired of being treated disrespectfully because of stigma.
Yeah, absolutely. It can be a barrier to reaching out for help. Um, Especially when it becomes internalized, it can take that extra effort. And when the systems out there in place are not supportive, it's just not a good thing to support their recovery, health, and well-being.
Yeah, I think the internalized stigma is a big deal.
Mhm.
And then because so much of the stigma is related to negative self-worth, yeah, as in people see themselves as not worthy of care, of not worthy of treatment. And so when people have a slip up, if someone's been in remission from, say, their opioid use or their alcohol use, and then they return to use, a lot of the times I hear from my patients, they're just like, I don't want to disappoint anyone. Just screw it. It doesn't matter what I'm doing now. And so people have internalized that negative view of themselves, what we've been giving them over and over and over again. People start reflecting that onto their own lives.
What can be done to address stigma in the community systemically and within the structures that people with substance use disorders encounter?
There's a lot of individual work that can be done, and I know you have other people talking about that, but I think that the structural work all starts with individual work. It starts with everyone grounding in treating people like people. And that sounds easy, but we all know that we carry our biases with us. And so some of the things that I talk to people about when I'm doing individual training on stigma is grounding an encounter with someone that you've never met in the love and respect that you have for someone that you know. So you may not know the person with alcohol use disorder who you're going to walk into that next exam room to treat. And you may be hearing everything, from the nurses that this person's a horrible alcoholic and they've been in 10 times this last year and they're never going to get help. But if you can ground that in, this person's suffering from the same disease that my uncle had, and you think about the love and respect you had for your uncle, and then you carry that with you into the encounter, that's a really powerful way individually to deal with that stigma. How do we do this as from system levels? A lot of it is to stop making assumptions about who or who might not be suffering from a substance use disorder. Some of the work that we've done is, we're starting to screen people for substance use disorder in our emergency rooms. And rather than saying, we're going to let the nurse or let the doctor or the person at the registration desk choose who they think is using substances in a way that maybe they want to change that day, we're asking everyone who comes in the door, and we're asking everyone the same questions. And so then it isn't a matter of I'm picking you out because of how you look or how you're acting or what's written in your chart. I'm going to be asking everyone the same questions because I genuinely am interested in the answers to those questions and want everyone to have that same opportunity to seek care. And I think this is a huge part, there's statistics tossed around that like only 5 or 10% of people struggling with opioid use seek help. And I think those statistics are inflated. I think that if we had medical systems and therapy systems and carceral systems where people were treated with respect, then I think all of those times in people's lives when they have that motivation to make changes, because people are really smart and courageous and often make the best decisions for themselves, that they can capitalize on those moments when they feel able to make change and be welcomed and get the support that they need in those moments. And I think what we see right now with the relatively low proportion of people who seek treatment is a combination of it's hard, and if you go a place and you just get disrespect over and over and over again, you stop reaching out. I'm not sure if I answered the question though about systems. Um, so maybe that wasn't the best question to choose.
That was a great response. Um, if you have more to add on systems, feel free.
Yeah, I think another way that we help overcome stigma in our systems is we build our system so that we incorporate people who have experience from a lot of different walks of life. And this is true for people who use substances. This is true for minoritized communities. But if someone knows that that receptionist that they really love, who always, calls them, or that doctor who they really like interacting with as a medical assistant, if they know that person also has a history of substance use disorder, then they become that touch point where that person now, it's no longer like, here's an alcoholic. Oh, this person is like, Dr. Smith. They are struggling with the same disorder. They're struggling with the same disease. So incorporating people with lived experience into the day-to-day work of what we do in any setting, that's really important. And that means building pipelines for people. And that means building systems where people who have struggled with use disorders are able to be hired and move up professionally within the organizations that we run.
Absolutely. And I think that visibility piece and the support of visibility in the systems can also be important because then it's showing that that system is standing with the acceptance of the visibility of recovering from a substance use disorder.
And visibility is key because we know that there are people with substance use disorder or with a history of a substance use disorder in all of our workplaces. But we've made those workplaces such fearful places that most people don't feel comfortable sharing that because they're worried, understandably, about negative consequences.
That speaks to that stigma again and the influence of it and why it's so important to have these conversations so we can raise awareness and hopefully eliminate stigma to then support people.
Right now we know that opioid use is the leading cause of death in adults under the age of 50 in this country. And I sometimes play the thought experiment. What would it be if something else were the leading cause of death in adults under the age of 50? Like, what if it was a brain cancer that we could find easily and treat easily? You would go for your every 3 month checkup in the clinic, and they'd walk you through the MRI machine, and then you'd go see your doctor, and you guys would look at the picture. And if it showed the brain cancer, you'd set up the appointment with the neurosurgeon. We'd have this amazing medical system that was tailored to address that problem. And we have a problem that is easily treated. I mean, not, but as easily treated as many other chronic medical conditions with good medications and good behavioral support. And yet, if you walk into a random medical office in the country, the chance that you'll find someone who's willing to help you with your opioid use, your opioid use disorder, that chance is really low. And that disconnect between what is killing people and what are we doing as a medical system, that's all stigma.
That's true. It's a huge problem. Well, thank you, Dr. Lyon, for sharing your views on stigma. And thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together, we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a good day.
Thank you.